Alright, so I started with clarify. Let's start with 7 out of 10. 7 out of 10. Do 7. I'm irrigating with hypo, getting all that necrotic tissue flushed out. So that's 10. Okay. And 23, right? Brush, 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 brush. Now. $12 cc's of hypo. 22 and a half, right? So now, number 10. Again, brush, 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 brush all the walls. My irrigation needle, even with that, I kind of brush the walls. When I go in, up and down, up and down, up and down, and almost. $45. Okay, so it's kind of loose still. 45. Any debris? I don't. So. Okay, excellent. All right, I'm good. All right, so we started to cut. Really good. Okay. Custom fitting the gutter percha. Leave the high point 8 and 9. Final rinse with 70% isopropyl. Okay. Section out all the isopropyl. And then we use paper points, wick out the remaining isopropyl. Gutter percha points, dip in sealer, and slowly place it in the canal. Very good. Very good. All right. You remove the gutter percha. Put one more in there, please.
30?
So I see a little void in my gutter percha, so I'm gonna use another gutter percha point and seed it to make sure that I got the void there. All right, now the gutter percha gone. Thank you. Okay. All right, so let me have the microsuction posted. Let's go to 8 and 9. MTA plugs, and then gutter percha sealer. You can dance with 23 and 20. MTA carrier, of course. Thank you. Okay, excellent. And then I'm using my number 60 stainless steel K-file to push the MTA to my working length. I don't care if I extrude the MTA. The MTA is extremely biocompatible. So years of post-op that showed amazing, fantastic healing. So I don't care if my MTA extrudes to the periapical area. That's good. I have about maybe 5 millimeters of MTA plug, and that's good for me. So number 8 is done. The MTA plug is placed and it's done. Actually, now it's more. Do our plug. That's good. And some apical resorption of the root. So now I really want this MTA pushed a little bit to the periapical area. I want to make sure that I seal that resorptive defect really good with my MTA. So right now about maybe 4 millimeters, and I think that's it. Those.
Okay.
My gun. I let it sit there for a few seconds to heat up the canal walls. Light. Thank you, Dr. Hughes. Thank you, ladies. Thank you. Thank you, Oksana, for filming. Okay, so teeth number 7, 8, 9, and 10. We have multiple angulations. As you can see, large periapical radiolucencies that are associated with these teeth. She is 17 years old, and she had all of these dental fillings done a few years ago. And she presented with this, of course, as you can see, labial sinus tracts. So today we sedated her, dental anxiety, dental phobia, and completed the root canals. So I was able to get away with gutta percha here for 7 and 10, but for 9 and 8, I did MTA plugs followed by gutta percha and sealer. Everything worked out really well. That's another angulation, as you can see how large these periapical radiolucencies are. But everything worked out really well for the patient and for us. I'm very happy, very optimistic that her infection will go away.